and welcome back, and a warm welcome to you if you're new to this channel. My name is Lydia and this is Time with Lydia the Pharmacist. Today I'm going to be spending some time with you talking about how to get rid of vaginal yeast infection. Vaginal yeast infection is a very common infection and about 75% of women would experience this in their lifetime. A vaginal yeast infection is a type of fungal infection. It is caused by a type of vaginal yeast called Candida. This yeast called Candida lives naturally in the mouth, in the bowel, or in the digestive tract, and a small number lives naturally in the vagina. It is mostly harmless, but when there is an overgrowth, symptoms can develop, and when this happens, you develop a yeast infection. A yeast infection in the vagina can be very uncomfortable, and today we are going to focus on how to treat or how to get rid of a yeast infection. Please don't go anywhere because today I'm going to give you a detailed step-by-step process on how to get rid of a vaginal yeast infection. First of all, let's look at some of the factors or some of the things that can cause a vaginal yeast infection. A number of factors can be responsible for an overgrowth of yeast in the vagina, and these include taking antibiotics. Antibiotics that are taken for infections kill the good bacteria that keep the growth of the yeast in your vagina in check. And when this balance is no more, the yeast then grows rapidly, leading to a vaginal yeast infection. Another very common cause of vaginal yeast infection is pregnancy and hormonal changes. Anything at all that disrupts your hormonal balance can cause an overgrowth of Candida in the vagina, leading to a vaginal yeast infection. So things like pregnancy, birth control pills, and even during your menstrual period, you can have an overgrowth of yeast in the vagina, leading to a vaginal yeast infection. Another cause of vaginal yeast infection is poorly managed diabetes. Yeast in the vagina feed on glucose in the urine. So anytime there is an excess of glucose in your urine, there is an overgrowth of yeast in the vagina. Also, when you have a weakened immune system, for example, when you're suffering from HIV or AIDS, the condition can weaken your immune system. Also, when you are undergoing chemotherapy as a result of cancer, your immune system can be suppressed. And these, apart from preventing you from fighting against infections, can put you at risk of developing infections such as vaginal yeast infection. Now let's move on to the symptoms of vaginal yeast infection. As I said earlier on, the symptoms can be very uncomfortable and they range from mild to moderate and severe symptoms. The symptoms include itching and irritation in the vagina and the vulva, that is the external area around the vagina. There can also be a burning sensation, especially during intercourse or whilst urinating, redness and swelling of the vulva, and there can be vaginal pain and soreness. Sometimes a rash can develop in and around the vagina. Another typical symptom is a thick, white, odor-free vaginal discharge with a cottage cheese appearance. You can also develop a watery vaginal discharge. So now let's move on to our highlights of today: how to treat or how to get rid of a vaginal yeast infection. Remember, I said earlier on that yeast is a type of fungus. So antifungals are mainly used to get rid of a vaginal yeast infection. These are medications that you can purchase from your local community pharmacy for mild to moderate symptoms, as well as infrequent episodes. You can visit your local community pharmacy and have a chat with your pharmacist. They will be able to help you out by prescribing an over-the-counter medication for you to use to get rid of the infection. Just take note, a vaginal yeast infection is not a sexually transmitted infection. Examples of medications that are used to get rid of vaginal yeast infection include intravaginal creams such as clotrimazole 10% cream. This is used as a single 5-gram dose at night. There is also miconazole 2% cream, and this is also used intravaginally through an applicator for 7 nights. There are a wide range of intravaginal pessaries as well, and these are in the form of a bullet shape that you insert into your vagina. They work very perfectly, but they are not recommended for children. Examples include clotrimazole 200 milligram pessary, and this comes in a pack of 3 pessaries. You insert 1 pessary at night for 3 nights. There is also a 500 milligram clotrimazole pessary, and this is one that you insert as a single dose at night to get rid of vaginal yeast infection. Other examples are iconazole pessaries, miconazole pessaries, and fenticonazole pessaries. I just want to point out here that the medication that may be prescribed for you may vary based on the formulary that is used in your area or in your country. Also available is a single dose oral capsule. This is called fluconazole, and the brand name is diflucan. This medication is taken as a single dose, 150 milligram fluconazole, and is able to get rid of vaginal yeast infection. And take note, it is not recommended for pregnant women. Now let's move on to some home remedies that can help provide relief when you're suffering from a vaginal yeast infection. Now, the first one is use an emollient as a soap substitute to wash and moisturize the vulva area. Avoid contact with irritant soap such as shampoo, bubble bath, shower gels, and wipes, and avoid vaginal douching. Avoid wearing tight-fitting and non-absorbent clothing, as these may irritate the area, and avoid the use of complementary therapy such as application of yogurt, probiotic, tea tree oil, or other essential oils, as these may irritate the vagina and the vulva area. Now let's talk about some preventive measures. It is very important that we all as women prevent ourselves from developing vaginal yeast infection, because you don't want to go through the trouble of suffering all these uncomfortable symptoms. So to reduce the risk of vaginal yeast infection, carry out these preventive measures. As much as possible, try wearing cotton-made underwear and avoid wearing very tight underwears. It might also help to avoid wearing tight-fitting ties. Avoid douching, as this may remove some of the healthy bacteria from the vagina, and this would result in an overgrowth of yeast in the vagina. And also avoid the use of scented feminine products such as pads, tampons, and bubble baths. And also avoid the use of unnecessary antibiotics. For example, using an antibiotic to treat a cold is very unnecessary, as a cold is mostly a viral infection. And avoid staying in wet clothes such as swimsuits or working attire for a long period of time. If you develop frequent vaginal yeast infections, for example, you develop more than 4 infections in a year, please make an appointment with your doctor and have a chat with them. They will test to confirm that you have a vaginal yeast infection. They would also order a blood sugar test. They will test for HIV and AIDS. They would also discuss any possible hormonal changes, that is birth control pills or pregnancy, with you. Finding out exactly what the underlying condition is and taking the right course of action will prevent future episodes of vaginal yeast infection. I hope this video is helpful. Please remember to give this video a thumbs up. Share with your family and friends. And if you haven't yet subscribed to this channel, I don't know what you're waiting for. Subscription is free. Please hit on the subscribe button right now and also on the notification bell so you don't miss any of my interesting videos. Leave a comment in the comment section. Tell me if you've ever suffered from a vaginal yeast infection and what you did to get rid of it. I would love to read from you. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.